Hi, my name is Dan, and today I wanted to do a quick video showing the evidence that supports yoga for the treatment of depression. For the new year, there was a 30-day yoga challenge on the YouTube channel Yoga with Adrian that I did. And when I would do the yogas after work, so after I got home from work, I would do the daily YouTube video. And I noticed that I started to feel better after I would do it. And it really helped at the end of the workday to decompress through the yoga practice. So I wanted to look at some of the evidence to see if there was evidence out there that supports yoga for depression, and there was. And it makes sense to me because we know that meditation and mindfulness practice can improve depression scores, and we know that exercise can improve depression scores. So combining the two, which seems to be what most yoga practices are in the West, would make sense that that would be helpful. So I just wanted to go over some of the evidence that I was able to find that supports yoga for depression. Before I get into the studies, I just wanted to throw out there that I'm by no means an expert on yoga. I know there's many different types. The studies seem to be mostly for Hatha yoga, if I'm pronouncing that correctly, which is like the Western way to do yoga, which includes physical postures, breathing exercises, and almost like a meditation component as well. All the studies that I'll be talking about seem to have those components, the breathing, the physical postures, and the meditation, except for the meta-analysis included some other yoga practices that weren't that type of yoga, that didn't have the physical posture component. One of the things that impressed me about the evidence is that it's not just US-based studies. There's trials all over the world, which adds to the value of the evidence that we have, because then this shows that different cultures, people of different backgrounds, genetic backgrounds can all benefit from the treatment. The first trial I wanted to talk about was out of Australia. It was a 6-week trial with 101 patients. And the options in this trial were either a 6-week yoga course or being placed in a control group, which was being placed on a wait list for the yoga course. So they weren't actively doing anything. What this trial showed was a 4.3 decrease on the depression score that they used, the DAS-21, which also accounts for anxiety, and then a 1.91 decrease on the anxiety score compared to the control group. So a component of this is that there seems to be no side effects with yoga as well, other than the potential for like physical strain or something like that. There's not going to be the same risk that there are with, say, taking medications or supplements. So this 4.30 decrease in depression scores is basically for free, other than meaning the opportunity cost of time and effort. Another component I wanted to comment on that first trial from Australia was that the yoga was taught over 4 individual 1-hour sessions over the 6-week period. So this, and then the patients would practice the yoga at home afterwards. So this takes away one of the variables, which is the social component of yoga. So if you go to a class with a bunch of other people, that could potentially also help with depression scores as well. But this trial didn't do that. So the benefit that was seen here was most likely due to the yoga practice itself, not a social component. The next trial that I wanted to talk about was a small trial out of San Francisco. And in this trial, patients were excluded from the trial if they were taking antidepressants, supplements, or receiving therapy. So this wasn't an add-on therapy. This was just seeing if yoga alone would help with depression scores. And in this trial, the patients received either a 90-minute instructor-led yoga class twice weekly, or a 90-minute twice weekly education group on the history of yoga. So that was the control group, was the educational class. And what they used the Beck Depression Inventory, which is a commonly used depression scale. And what they saw here was that the yoga group had depression scores decreased by 9.47 as compared to 2.99 in the control group at 8 weeks. So 2 months into this trial, the patient's Beck Depression Inventory was decreased by 9.47 points, with just yoga alone. So remember, these patients weren't on antidepressants or in therapy. So that's phenomenal numbers for, again, a treatment that has virtually no side effects. I was able to find a meta-analysis, which is whenever the researchers get a group of many different studies and trials and combine them into one big review of that evidence from 2017 that looked at yoga for the treatment of major depressive disorder in Germany. They used studies from Germany, India, and the United States. And what they found in the overall collection of this data was that yoga was as effective as exercise and medication for the treatment of depression. So again, this evidence is piling up on how effective yoga can potentially be without the side effects that other treatments for depression have. A final trial I wanted to go over was out of Rhode Island, and this compared 63 patients that received either weekly or twice weekly yoga sessions or health education classes, and they utilized the QIDS scale to assess change over time. And they didn't find a difference between yoga and the health education classes. So this could mean that in this trial, yoga wasn't effective for treating depression, but the scores still did decrease. So the scores decreased 3.93 points in the yoga class as compared to 3.15 for the health education classes. So they did both decrease, or this could just show that the health education class was potentially somewhat helpful for the treatment of depression. Most of the evidence seems to be positive. I wasn't really able to find any trial that showed worsening of depression scores. All of them showed some benefit. It was just the degree of that benefit that was hard to really determine. But again, this isn't a medication that I think would need to be rigorously studied to determine the risk versus benefit ratio, because in yoga, the risks are very low. So the risks are mostly physical risks. There aren't risks to the mental state or to increase suicidality or anything like that. At least that's what it seems like. So with this high potential benefit with almost no risk, I think that it makes sense to give yoga a try for the treatment of depression. The evidence seems to support that as well. So I hope this quick overview of some of the evidence I was able to find was helpful, and a quick review of my own personal experience with yoga seems to be beneficial to me as well. So thank you for watching.